I was having a hard time figuring out if I should make this video. I was wondering, would this give value to my audience? Would this help someone with tinnitus? Would this scare someone with tinnitus? Would this hurt someone in our community? I want to give you the opportunity right now. If you're someone who feels very afraid or gets very triggered by hearing emotional news, then stop watching this video. The reason that I'm making this video is to address the recent suicide of the Texas Roadhouse CEO. Their name was Kent Taylor, and they committed suicide after living with what was considered unbearable post-COVID symptoms. Mr. Taylor was infected with COVID-19 and developed some serious post-COVID-19 symptoms of that, including severe tinnitus, also pronounced tinnitus. The family said in a statement, and I quote, "Kent battled and fought hard like the former track champion that he was, but the suffering that greatly intensified in recent days became unbearable." Now, I'm making this video because as a medical professional, we are relatively familiar with telling families and patients very sad and difficult news. For me, as an audiologist, that's typically you have permanent hearing loss. This is not coming back. Or for someone with tinnitus, the bad news sometimes can be, this is not a quick fix. This takes many months to typically show signs of changes to tinnitus. The family also added to this statement, "We are saddened by the decision Kent felt he needed to make and want to emphasize more than ever the importance of reaching out for help if you or someone you love is suffering." One of my patients that I was working with recently via telehealth, they said to me, "Well, Dr. Ben, I wish that they had seen you. Things might have been different." And my heart skipped a beat. I wasn't in the position of thinking that I myself would have swayed someone out of suicide or considering suicide. But then I reflected, then I thought about it. And every week, it's not uncommon for me in telehealth consultations to meet people who say that at some point they thought about ending their life because of tinnitus. So I told you earlier I was a little afraid to make this video myself because I don't want to trigger someone. I don't want to bring someone back into a fear-based outlook on their tinnitus, but it is important also to raise awareness for mental health. So as you can see here, I'm in a bit stuck between a rock and a hard place. However, I feel that if you're still watching this video, you're able to breathe and swallow this information and be okay with it. Yes, suicide is real. Yes, stress, anxiety, insomnia are real. Yes, tinnitus can be incredibly hard to live with at times. Now, what do people tell me when they reach out to me and explain about their hardships with tinnitus? Well, oftentimes they say, "Thank you so much for making these videos because they helped me. I was considering suicide. I was considering something to harm myself because that's the only escape I felt like I had with my tinnitus." And the videos on this YouTube channel helped me have the motivation, helped me stay with it, and they were reaching out to me in gratitude and thanks. Of course, some of those people still had a long way to go, but to me, that feeling is one of the most incredible feelings of service that I could ever have imagined. And I didn't fully understand that when I started this devotional vocation, this job and profession with helping people with tinnitus, but certainly that feeling is incredible, and thank you to anyone who has reached out to me and said that. And part of this video again is to raise awareness about mental health, to destigmatize how sometimes we do have suicidal thoughts, and if you have a plan or you're considering a plan for that, please reach out to your doctor, a support line. You can call someone and talk to them within 5 minutes, no matter what time of day. Please do that. It's very, very, very helpful to get out of your mind, to say it, to talk what you're going through with someone. Oftentimes that's very comforting. But what the CEO of Texas Roadhouse here, Mr. Taylor, showed is that even if you have a lot of money, a lot of resources, you can still suffer from mental health. You can still suffer from stress, anxiety, depression, and that may be linked to tinnitus. So my friends, I'm here to say that this is very unfortunate, and we also don't want to point at tinnitus for being the reason why he committed suicide. It's very common in our profession where someone says, "Oh, my tinnitus is the reason why my life is negative," or "It's the reason why I can't do this," or "It's the reason why things have gone bad." And sometimes unpacking that with an audiologist, with a therapist, with a psychologist, sometimes unpacking it, it becomes clear that we point to tinnitus as the problem, and it is a problem for some of you, I understand that, but it also represents other things that maybe we're not looking at and pointing at directly. So I don't know the history of Mr. Taylor. I don't know his psychological history. From what I found, the family did not release in-depth medical records or explaining more details, but there was a mention that severe tinnitus was part of his medical history after COVID. As we know, COVID-19 has affected many people, causing hearing loss, causing tinnitus. I made this video to bring awareness to this issue, to educate you, and also to hopefully bring my calm voice, which many of you tell me my voice is calming, so thank you. I was born this way. I didn't train to be this way. Hopefully my voice can help take away some of that fear and shock and horror about this issue and be real with ourselves. Look inside, understand what's going on, reach out for help as the family had recommended. If you need help from us, please reach out. If you have chronic stress, anxiety, depression, insomnia, there are many resources. There are many different modalities. If you've tried something to help with your tinnitus, but it hasn't worked yet, do not give up.